I'm Dr. DeShawn Taylor, and we're getting started a little bit late this afternoon. Appreciate you hanging in there with me. Today, I am going to be addressing a topic that I think a lot of people think about is this vaginal discharge a sexually transmitted infection? And so I have a few points that I want to share with you regarding that today. Again, let me introduce myself. I am Dr. DeShawn Taylor. I am a board certified gynecologist and family planning specialist, and I am the owner and primary provider at Desert Star Family Planning Clinic in Phoenix, Arizona. And so I've been coming to you the second and fourth Wednesday of the month for my Well Woman Wednesdays educational series. And so I thank you for joining us. And definitely, if you find this information useful to you, please share with someone you care about and follow us on Instagram, Facebook, and on YouTube, where these live sessions get saved for future view. And so let's go ahead and get into it. So the first thing is that it's important to understand that the vagina is self-cleaning. And so the vagina cleanses itself naturally. And so we will naturally have a vaginal discharge. And so the discharge in and of itself is not problematic. It's just what happens as we go through our cycle and the natural process of the lubrication and cleansing of the vagina takes place. And so when you have an unusual discharge that I will describe in more detail, it's generally accompanied by a vaginal irritation, possibly an odor, maybe itching around the outside of the vaginal area. And so this may be a sign of a vaginal yeast infection. It might be a sign of a bacterial infection, both of which are not sexually transmitted. But then also, it could be a sign of a sexually transmitted infection. And so how do we know whether that is the case or not? And so there are three main sexually transmitted infections that can cause vaginal discharge. And those are chlamydia, gonorrhea, and trichomonas. And so when trichomonas causes symptoms, it can range anywhere from a mild up to severe vaginal irritation and inflammation. The signs in terms of discharge varies. It could be clear, it could be white, it could be greenish or yellowish. And that is what's occurring from the vagina in females. And that also can be a discharge that occurs from the penis in males. And so in terms of chlamydia, most people, up to 70% with chlamydia, don't even know that they have it because they don't have symptoms at all. And so when people do get symptoms, the most common symptoms include a whitish vaginal discharge, possibly, maybe a gray, and pain with urination. And so, especially in men, that can be the presenting sign in people with a penis that they have burning with urination. And that's called a urethritis. And with gonorrhea, the symptoms, there's a little bit more chance that symptoms occur with the gonorrhea, and those discharges could include watery, creamy, slightly green discharge from the vagina or penis, pain or burning with sensation with urination, both in males and females there. And so, again, it's hard to determine what's going on because these symptoms are also similar to non-sexually transmitted yeast and bacterial infections. And so it's really important to, when you're having sexual relations and you may have new partners, or you may not be sure if your partner is monogamous, it's just really a good idea to be tested. Know your status. My philosophy is that when I'm seeing my patients at their annual examinations and they're sexually active, may have had new partners or a partner that may have another partner, I always suggest that people just get screened. Because again, most of the time when people have a sexually transmitted infection, there aren't any symptoms. And oftentimes I am diagnosing sexually transmitted infections in people who otherwise felt fine and felt that they weren't at risk. And so then when you start to think about the fact that you've had multiple sexual partners, you're not using condoms for sexually transmitted infection prevention, and you have more risk when you have more sexual partners to have a sexually transmitted infection. So when we're looking at the discharge, we're looking at, in terms of your concern, your level of concern of whether you have a sexually transmitted infection is really based on what your risk is, based on your sexual activity and what you're doing. And so as a general principle, when you have a discharge and it is otherwise no odor, no irritation, no urinary symptoms, then it's probably a physiological discharge. However, if you know that you recently had a new partner, you didn't use condoms, your partner might have symptoms, your discharge is now a yellowish or greenish color, there's an odor associated with it, you have some additional symptoms, now that's starting to raise the idea that it might be a sexually transmitted infection and it should be evaluated. And honestly, a lot of people come in for sexually transmitted infection testing and they're negative, and it turns out that they have a vaginal yeast infection or a bacterial vaginosis. But you want to be able to know for sure that you don't have a sexually transmitted infection, right? Because we talked recently about untreated chlamydia infection and the risks for pelvic inflammatory disease, which could lead to scarring of the female pelvic organs, which could lead to infertility, which is the difficulty becoming pregnant. And so we don't, when these are treatable conditions, right, we don't want to put ourselves in the position where we can have long-term effects from something that has a cure. Okay, so a couple of things that I want to remind you about in terms of your general overall vaginal hygiene is that you want to keep your vaginal bacteria balanced, and the way you do that is to maintain the appropriate pH level. And so ways to make sure you're doing that is use warm water only when you're cleaning the outside of the vagina. So remember that the vagina is the actual entrance. It's the hole that then is a cylindrical space that at the end of that is the cervix, which then goes to the uterus. And so we're not putting anything inside of that space, right? So when we're cleaning, you're using water to clean along the outside of that. The vulvar area where we have what we call the lips, right, of the vagina, you're getting in there to clean with water. Otherwise, you can use your soaps and your body washes and things on the external areas of the body. But please don't use soap, don't use perfumed specialty things there, because even mild soap can cause irritation there and upset the pH balance. Another important hygiene thing is to wipe from front to back when you are using the restroom, so that you're not pushing potentially bacteria from the anal area up towards the vagina, which could be an irritating factor. Also, keeping the area cool and dry by wearing cotton undergarments, cotton-lined underpants is so important, because if you're trapping moisture in the area, then that can be a problem as it relates to altering your pH balance and putting you at risk for having a vaginal discharge, which then can become a source of anxiety for you. The other important thing is do not douche. Douching upsets the balance of the gut bacteria. in the vagina. And it also masks if there's something going on. Like if you have a discharge that is unusual, if you have an odor, then please, we want you to come have that evaluated, and don't try to cover it up with perfumed things and douching. And so, again, when you have a vaginal discharge and it has an unusual color, an unusual odor, it may be associated with vaginal irritation, burning with urination. Then you are at risk potentially by having protected sex, by having multiple sexual partners. Then that's going to raise the chance that you might have a sexually transmitted infection. And again, those infections that can cause a discharge most commonly are gonorrhea, chlamydia, and trichomonas. And every single one of those can be treated very quickly and easily with a course of antibiotics. And so I hope this information was useful to you. Again, if it was, please share with someone you love. And I will be back here again on the 28th and with my next topic. And I hope that you will join me. You guys have a great rest of your week, and we'll see you next time.